Hi, it's Dr. Tim. In this video, we're going to talk about facial fat transfer surgery. We'll cover what it is, how it works, how it compares to similar procedures, and what you can expect during the recovery process. Despite the fact that the world today is obsessed with losing fat, we actively lose fat in our faces as we age. Replacing this lost fat can be a great way to rejuvenate the face without big incisions. Most people may notice some hollowness in their temples or their cheeks, but every aspect of the face can be addressed to ensure a seamless appearance. This holistic approach is not typical in most practices, and I believe it is one of the things that truly sets us apart. I start by removing the fat from an area that you don't want it. Tummy, love handles, your back, using liposuction. Then it's processed with a centrifuge to ensure that we only get the best fat cells. And then using a small blunt needle, called a cannula, we can replace the fat that has been lost. The goal is never to make you look like someone else, simply a younger version of yourself. Let's take a look at a couple of case studies. What you see in this pre-op photo is that the patient has lost volume in the form of fat, which is a normal part of the aging process. Specifically, she has hollowness above her brow, the root of her nose, bags under her eyes, as well as some of the jowling and nasolabial folds. By using her very own fat in a very holistic manner, we've been able to restore those areas, and not just using temporary filler, but using a long, durable approach in facial fat grafting. And what we see afterwards is that all of those facial contours have been restored to a state where they were 10 to 15 years ago. It doesn't look overdone or puffy, and she can expect to experience those results for 10 to 15 years to come. In this case, the patient already had a relatively nice jawline, but overall, it was the lack of volume in her face that was giving her premature age. And so she was a great example of the ability to be able to use fat from somewhere you don't want it, tummy, hips, or thighs. We then process that, and then we're able to transfer that back into her own face, where she can get nice, long, durable results. In this particular case, the volume that you see through her lower cheek, her mid-face there, and the lack of an under-eye bag is really well highlighted here. And she also had a contour deformity on the dorsum of her nose that we were able to address with just fat without having to go through a nose job or rhinoplasty surgery. Patients frequently ask about articles where they've heard of people being overfilled. Do not worry, fat grafting is a safe, natural way to rejuvenate your face. Let's talk about fillers. They are safe, but temporary, lasting 4 to 12 months. Typical filler volumes may be 1 to 3 cc's, depending on how many areas of the face that you're treating. The goal with fillers is typically to camouflage that volume loss. Fat, we may graft anywhere from 10 to 20 times that volume, depending on the extent of volume loss. From this standpoint, fat becomes a much more natural, cost-effective, durable solution for facial aging. You may have heard that fat dissolves. Not all the fat transferred will survive. About 70% of the fat will survive the transfer, and it will last forever. However, the aging process does not stop. Most patients get about 10 years from their fat transfer before they may begin to notice some more volume loss. Fat transfers are typically done under general anesthesia and can be performed alone or with other face procedures like eyelids or a facelift. You can go home the same day. Swelling is very typical after the procedure, which makes downtime about 1 to 2 weeks. There's very little pain, if any, and you will see the final volume from your transfer about 2 to 4 weeks following your surgery. Proper nutrition after surgery is very important. The fat is made of living cells and they must be nourished. I recommend supplementing your protein intake as well as adding good healthy fats to your diet for the first month after surgery. Do not start a weight loss diet immediately after a fat transfer. I also do not recommend placing ice on an area that has just received fat. This is called cool sculpting and can destroy the fat that was just transferred. If you are tired of looking tired, we would be happy to meet with you and create a plan uniquely suited to your concerns. We look forward to meeting you.